My name is Andrew Sherman, and I'm Chief of the Department of Cardiovascular Surgery at St. Joseph's Hospital, which is part of the BayCare health system. I think what's unique about our Heart Institute in the new tower that's been built is that it breeds collaboration. So every aspect of the care that our patients will receive in our institute has all been upgraded. The electrophysiology laboratories have all of the state-of-the-art equipment that they will all use. Our operating rooms have everything better than we could ever, have wished for in terms of the ease of equipment getting in and out of the rooms, the ease of getting patients in and out of the rooms, the ease of, taking care of the patients during the operation. So we as the surgeons can be concentrating on what we need to concentrate on, which is doing the operation. Everything else will be completely streamlined around us. Plus, we have state-of-the-art catheterization laboratories that will be right next to our operating rooms. There will be no anybody getting in an elevator who needs something from a catheterization laboratory and then needs to get to an operating room. They'll be literally right next door to each other. And one of our most exciting aspects of this is our new hybrid operating room, which is, we went to visit a number of centers throughout the country and picked what we thought was the best aspects of each of those operating rooms, the hybrid operating rooms, and chose those for our particular room. And we are incredibly excited about, number one, the amount of procedures that we'll be able to do in there, including minimally invasive aortic valve work, which is one of the major things that we will be providing, plus a lot of the procedures that we've been doing in terms of atrial fibrillation surgery, where we have done a component in the operating room, and then we take the patient up to the electrophysiology laboratory and we do another component of that operation. That will all be now done within our hybrid operating suite. One of the major procedures is the transfemoral or transapical ability to do aortic valve replacements now. And the hybrid operating room is a necessity in order to offer those procedures to our patients within the St. Joseph system. We have cardiologists, anesthesiologists, radiologists, everybody that could be available to us on our TAVR team that will all be within the operating room, streamlined in order for these procedures to get done. And they are amazing procedures from a technical standpoint, and they require an enormous amount of teamwork, and the size of our operating room is can accommodate our team, if not 3 teams of people that could do TAVRs. It's really a remarkable room. Very nice component of our hybrid operating suite is a number of the minimally invasive lung surgery procedures that we've done, the thoracoscopic lobectomies, the minimally invasive esophageal surgeries that we do. And a hybrid operating suite is an excellent area for those to be done as well, because we have imaging that can be brought into that room as we're minimally invasive looking and dealing with the patients. We have all sorts of things that we used to have in separate components of the operating room or in separate areas of the department that will all be within the room. So I think what the benefit to the patient is when you're a patient, and in this day and age, you're seeing many different physicians, and sometimes it feels like things are disjointed. You go and see your cardiologist, then you go and see your cardiac surgeon. You may have a rhythm problem that you go see your electrophysiologist, and you're hoping behind the scenes that everybody's talking to each other. And a lot of the times that is happening, and a lot of the times, some of the times that's not happening. With our particular institute, it was made to mirror the collaboration and the team approach that we provide our patients in terms of their full cardiovascular care. So not only are they getting complete team approach once they're in an operating setting, or they're getting a cardiac catheterization, or they're getting an electrophysiology procedure, we're all there together in the same area of the institution, but we have conference rooms set up there for all of us to be collaborating. There will not be a patient that comes through this institution that will not have multiple physicians integrated in their care, talking with each other, talking with the patient, and everybody figuring out exactly what is best for that particular patient. Because that's ultimately what it comes down to, is there are ways that we treat groups of patients, but every patient's an individual. And even with large groups of patients, every patient is unique and needs to be treated uniquely, and that's where you need a team approach to everything. One of the things that I think is very unique to St. Joseph's Hospital and our beliefs of patient care is that we start with the patient first. And one of our major goals in terms of patient first is patient satisfaction, patient safety, and the efficiency with which we work with patients. And I think if you have that as your goal, is those three aspects of patient care, then everything filters down from here. Then everybody is on the same page in terms of every physician, every nurse, every technician, everybody who's involved with that patient care is, if that's our goal, and we all know at St. Joseph's that that's our stated goals, then everybody that filters down to everybody's involved with that patient's care. And that's what I think is a very important part. And if you're a patient looking for a particular hospital, that's something that's one of our main values. That's our core value, is that you are the most important part of what we try to do, and your satisfaction and your safety is key to doing that. And we feel that this institute we've developed is going to be help us achieve that goal.